The Eastern Cape Health Department is at risk of losing hundreds of doctors and nurses. That is due to issues with finances that the department is currently dealing with. Now, it's unable to retain people who studied on government bursaries, which would require them by law. This is the term of the contract, that once you've gone through varsity on this bursary, you do have to come back and work in a public facility in the Eastern Cape for a certain period of time as a result of the spend that budget would have put towards your studies. Well, the government would have put towards your studies, I should say. We're joined now by Nehawu Eastern Cape Secretary Mlungiseleli Ncapayi. Talk more about this. Mlungiseleli, a very good evening to you. Welcome to the program. So how is it that we end up in a situation where people who were essentially sent to university by the government are not getting work from the same government which said after you graduate, you do have to work in the province for the government?
Good evening, good evening also to the viewers at home. As we have said, that the department from where we're seated is playing now a game that is not sustainable, because you are talking about taxpayers' money that has been invested in terms of giving these doctors bursaries. Now, when they are supposed to come back to the Eastern Cape in terms of ensuring that the investment that has been made is going to assist the people of the Eastern Cape, more especially at this moment where their services are most needed. But if the department is failing, therefore, to employ these doctors, it therefore suggests that there's a crisis of leadership in that department, because we can't take these excuses that they're coming up with in terms of saying they are in financial crisis. What has happened in the past in terms of planning and making sure that by the time these doctors are completing their studies, they are ready to be taken in the system. So we don't accept that excuse at all.
Are you saying that the financial crisis is not real, or are you saying that you don't believe they've tried hard enough to get the money?
That's why we're clear. The department is not trying enough to get the money, because if you have senior managers that are given a responsibility to manage the financial resources of the department, it is unfounded now that at this particular moment they are shocked that they don't have money. What they've been doing in the past few months in terms of ensuring that by the time these doctors are completing their studies, there's enough money to ensure that they are affected in the system. So we don't accept, we don't, for example, say there's no, there's an excuse in terms of coming up with the resources, but the managers, the senior managers are there and employed, getting a lot of salaries, a big salary, to ensure that they come up with solutions for these kind of situations.
So as I was saying at the beginning of our conversation, many of the people who are unable to find work, whom you're representing at the moment, studied on bursaries from the Eastern Cape government, right, which requires them, as per the contract, to come back and work in the Eastern Cape. Is government now in the Eastern Cape in breach of that contract, and can you perhaps take them to court?
Yes, that's another case for litigation. As you know, that department continuously is complaining about medical cases that are escalating every day. So if now again they are not living up to its side of the promise in terms of the bursary contract, it therefore suggests that workers are at liberty to go and litigate the department again, because whatever that they are doing, they must know it is also affecting them in terms of joining the industry and then earning a salary and a living for themselves and their families. So there's no way that we can accept that kind of a situation where the taxpayers' money from the people of the Eastern Cape, poor as they are, and now it is more like it's thrown under the river or on the water. We can't accept that. The heads must roll. Those people that are given the responsibility of giving bursaries to workers, they must also make sure that by the time they are completing their studies, there's enough resources to ensure that they are taken back to the system, so that they give back to the people of the Eastern Cape that have sacrificed their money.
You've got 634 nurses and 128 other healthcare workers who are affected. What is the way forward? Can they get work somewhere else?
As per the contract, they are unable to get work from other provinces, because immediately they apply to other provinces and indicating that they are bursary holders from Eastern Cape. There's an understanding between amongst the provinces that these workers are not going to be allowed to go to other provinces. So from where we're seated now, the department should waiver that condition so that workers are allowed to go elsewhere. But it's not a situation that is something that we can support, because the people of the Eastern Cape, they need their skills. So there's no way that we can say from the top of our heads, those people must be then released from their contractual obligation. The department must find money. If the department is unable to find money, as from Monday, we are going on the streets. We are going to mobilize workers across the province to ensure that this demand is met, because we can't have senior managers that draw a lot of salary from actually every month, but they are doing nothing. That's what we're saying.
How long?
Heads must roll. Those senior managers, for the past 15 years, they've been creating a problem for the department and the province. So we can no longer now accept their excuses. And we're very clear that if they've been messing up the department for the past few years, they are unable now to come up with solutions. So we need an external intervention so that the National Department of Health can come in and make sure that things are managed in a proper manner, and the people of the Eastern Cape at least are getting good service from the department.
Let me ask you about that then, because the Eastern Cape government, from what I was reading, says in its explanation that it's a victim of budget cuts from national level. Have you taken up this issue with national government, the Minister Joe Phaahla, for instance, and as unions, could you perhaps coordinate nationally to get together all these student doctors and everyone else who's unable to find placement, even though there was a commitment per the bursary agreements, and put that sort of pressure on government?
Yes, that one is already in the process. We've spoken to our national office. They are ready now to come in and play their role. But as Eastern Cape office, we are very clear on what should be done. And we're not going to say we're going to accept what they are putting forward in terms of saying the National Department has cut their budget. What they have been doing in the past in terms of ensuring that the resources of the department are managed in an efficient and effective manner. Because there are many areas where there are wastages of resources, where they are unable to take decisions and ensure that they save the money and ensure the communities of the Eastern Cape are able to get the service from the department.
Very quickly, these hundreds of people who are waiting for placement, have they all been waiting since the beginning of this year, or have others been waiting longer?
For now, we are only aware of those that are supposed to be taken in this year, which is about 91, including now the other nurses. So those are the people that currently we're dealing with. But in terms of what should happen going forward, we're very clear as Nehawu that the department is not going to come up with excuses and then there's nothing that's going to be done. We're calling for those senior managers that have been there and ill-managing the resources of the department to be taken into disciplinary processes so that at least the people of Eastern Cape can see that something is being done to those people.
Thank you very much for speaking to us. Mlungiseleli Ncapayi, Nehawu Eastern Cape Secretary. Thank you for your time, sir.
Thank you very much, Buka.
So